Menstrual bleeding disorder is one of the commonest complaints women experience. This is rarely life-threatening. However, it can cause emotional, psychosocial, and occupational upset. Most of these women bleed between one menstrual cycle and the other. That's what we call intermenstrual bleeding. While for some, they experience heavy menstrual bleeding, and others bleed after sexual activity. That's what we call postcoital bleeding. Today we'll be looking at the causes and the management approach to heavy menstrual bleeding. My name is Dr. Godwin Obono. You're welcome to this channel, Medical Science Lecturer. We appeal to you to subscribe to this channel, like the video, share it. Heavy menstruation, known as menorrhagia, could be defined as blood loss greater than 80 ml per menstrual period. The method of calculating the volume of blood loss in this case may be inaccurate. For this reason, the clinical diagnosis of menorrhagia has been based on the patient perception. That is to say, if a woman from the time of puberty has understood or observed a volume of blood loss each time of menstruation, and suddenly she noticed that there is a change in the flow or in the volume of blood loss, for her, perhaps if the change is towards increase, in other words, if she's experiencing blood loss more than as usual, for that woman, it becomes a thing of concern for her, and she could be seen to be menstruating heavily. There are a number of conditions that might be responsible for heavy menstruation or heavy blood menstruation or excessive blood loss during menstruation. One of which is uterine leiomyoma, in other words, fibroid. A woman that has a fibroid is likely to menstruate heavily, is likely to lose a lot of blood during her menstruation. Also, a woman that has adenomyosis. Adenomyosis refers to a condition where the endometrium of the uterus invaginate or grow into the muscular layer. Usually, the uterus has three layers: the perimetrium, which is the outermost layer, the protective layer; the middle layer, which is the myometrium, which is the muscular layer. This is a layer that tends to expand during pregnancy and also contracts during delivery. And the innermost layer is the endometrium. So, if the endometrium, which is the innermost layer, grows into the muscle layer, remember that the endometrium has the uterine glands and the stroma. And so, when this grows into the muscle layer, at the end of every month during a menstruation, that layer or the endometrium is usually shed off, and so it sheds off even while in the muscular layer, and so resulting in heavy menstruation. Another cause of heavy menstruation could be endometrial polyps. Endometrial polyps refers to growths that are attached to the wall of the endometrium and then probably project into the cavity of the uterus. Another cause of heavy menstruation is coagulation disorder. An example is the von Willebrand disease. This is a disease where there may be deficiency of clotting factor or there is there is presence of clotting factor but is inactive. The function of a clotting factor is to prevent excessive bleeding because it allows for blood clot to form. And so when these factors or proteins are deficient, there can be excessive bleeding. And during menstruation, for such a woman, the woman tends to bleed even more. And so there tend to be greater blood loss during menstruation. Another cause of heavy menstruation could be thyroid disease, pelvic inflammatory disease. The woman who has heavy menstruation may also have or may have taken a drug, an anticoagulant like warfarin. She may have also she might be equally suffering from or having endometrial polyps. Or such a woman must have undergone a family planning procedure where an intrauterine device may have been inserted in her. So these are the possible causes of heavy menstruation. However, when this woman is menstruating heavily or when there is increased blood loss, there may be associated symptoms. For example, a woman who is having menorrhagia may have intermenstrual bleeding. In other words, she may bleed between one menstrual period and the other. She may also experience blood loss, increased blood loss at the end of every sexual activity. For such women, there may be high suspicion of endometrial cancer or endometrial polyps or cervical polyps. Also, for a woman who has a menorrhagia and at the same time have associated symptoms such that she bleeds at other sides of the body. At slightest injury, there is increased bleeding. Probably the woman equally had history of postpartum hemorrhage. For such a woman, that woman may likely be having coagulation problem. In other words, there may be a coagulation disorder. Now, for a woman who also have heavy menstruation at the same time, experiencing having vaginal discharge that may be foul smell, for such a woman, she may likely be having pelvic inflammatory disease. A woman that equally has skin changes and she gets tired, and in addition to heavy menstruation, may likely be having thyroid disease. So when these symptoms, sometimes they present with these symptoms, and that may equally increase suspicion for these causes that have been so identified. But the women who have all of these are advised to see a doctor. When they see a doctor will put them through a test in order to confirm what the history suggests. Because the doctor will first take an history, examine, and then from the history, you'll be able to know what might be the possible causes. And to confirm this, a number of tests may be performed. One of such tests is a pelvic ultrasound. A pelvic ultrasound can be done if in the history if the history is suggestive of a structural problem or a structural or histological abnormality. Remember that the causes of heavy menstruation can either be structural or hormonal. So if there is a problem with the uterus, that might be the reason for the heavy menstruation, then that woman may have to do a pelvic ultrasound. She may also be asked to do full blood count. The full blood count is to ensure that she's not anemic, because she is losing blood. The chances that she might be anemic. So a full blood count has to be done for her. Again, For this woman, high vaginal swab or endocervical swab can maybe done if there is suspicion of what pelvic inflammatory disease. Thyroid function test can as well be performed. Now, how would you manage this woman? How would you manage this condition of heavy menstruation or menstrual disorder? There are two approaches, one medical and surgical. The medical treatment may involve administration of levonorgestrel intrauterine system. In other words, this is inserted into the uterus. That's an hormone is inserted into the uterus. Again, tranexamic acid and mefenic acid can also be given. Gas gonadotropin releasing hormone agonist can also be administered. These agents have ability, or they act by acting on the pituitary to inhibit the release of what estrogen, and so it tends to induce a menopausal state. For such women, they shouldn't be long on this agent, on these drugs, because it may predispose these women to osteoporotic condition. Surgery can be done for such women, but before surgery can be done, we must be sure that the medical treatment fails. Failure of the medical treatment, then a surgical treatment can be done. Or maybe there is pressure symptoms. For instance, for those who have fibroid, for instance, if the fibroid is big enough, it may cause pressure symptoms, and because of those symptoms such as urination and so on, that might be the reason for you to do surgery for that patient. And the type of surgery for that will be myomectomy. But for people who have other also for some persons, for some women, you may have to do hysterectomy. And for hysterectomy to be done, it must be sure that that woman has probably had a complete family. The reason is that hysterectomy will result to infertility. Of course, there is a removal of the uterus. For such a woman, the woman will not get pregnant. So the woman has to be told this. She probably need to be someone who have had a complete our children, who shouldn't be expecting to have a child. So heavy menstrual bleeding can be controlled medically and surgically. The first approach has to be the medical approach, and then second is the surgical. Like I told you, surgically it is only when the medical treatment fails, or when there is pressure symptoms, as in the case of the leiomyoma or fibroid. Please, at this point, if you have any concern, any question, go to the comment section, drop your complaints. I will respond. Also, don't fail to subscribe to this video. Do not also fail to share and like the video. Thank you.